It's World Malaria Day that draws attention to the mosquito-borne disease. In 2022, almost 250 million people contracted the disease. More than 500,000 of them died from it. A vaccine has been in circulation now since 2021, and a second one has just been approved. But the disease continues to affect populations around the globe and even spreading to new regions with the intensification of climate change, with children under 5 and pregnant women at highest risk for the disease. For more on the story, our guest is James Tibenderana, who is currently in Rwanda at a conference on malaria. He is a chief executive at this Malaria Consortium, a malaria expert. Thank you so much for joining us on France 24. Let's start by talking about some hopeful news, the vaccine. There's one in circulation now. And in fact, Cameroon has been the first country to routinely give children this new vaccine. Is it effective? Are we seeing that it's working at all?
It's my pleasure, Shona, to be on this channel. Yes, the vaccine is effective. It's not as effective as we would expect for a vaccine against the viral disease. And the reports we're getting from Cameroon is that there's overwhelming demand for the vaccine. And even, I think, the Cameroon authorities are struggling to meet up with the demand. The data from the studies have shown that of the children who get vaccinated, 13% of them who would have died without the malaria vaccine have been saved. And that is children who would have died of all causes. It's not just children who would have died of malaria. And that is a significant result that will be beneficial across all the communicable diseases.
There are reports, however, of people and mosquitoes becoming resistant to the drugs, the medicine that is used to fight malaria as well. What can you tell us about that?
Yes, there are reports. And what I hope we should encourage people to understand is that there's a lot of work that's going to monitor that. So people should not suddenly hear that these tools aren't working and then stop using them, because for the success of the vaccine, we've got to be able to use our nets. We've got to be able to ensure that those who get fever are detected for malaria and treated. So in terms of the vector, there is evidence that the vector is able to produce enzymes that degrade the insecticide that is in nets and the insecticide that is used to sort of spray houses. But that is being mitigated by the new nets that are being introduced that countries are able to deploy in a manner that allows them to adapt to insecticide resistance. In East Africa, there's the emergence of anti-malarial drug resistance at the molecular level. It hasn't translated into poor health outcomes at the population level. And WHO and all partners are doing what is necessary, but we still need countries, we still need the funding that's required to treat this with urgency before drug resistance becomes established in sub-Saharan Africa.
Now, I know that we are, celebrating World Malaria Day, and malaria is a big issue around the globe. But there's another mosquito-borne disease that is spreading even faster these days, proportionally than malaria, and that's dengue. Is the fight against dengue being at all coupled with the fight against malaria? Are they being treated as really two different diseases? Both of them, of course, coming from mosquitoes.
So they are being treated differently. The mosquitoes, I would say, we all look at mosquitoes and they seem to be the same, but the mosquitoes are different. Dengue is a disease that spreads in urban areas, whereas malaria is a disease that spreads in rural areas, although there's a new malaria vector that's starting to spread in urban settings. Dengue is more complex because we don't have the appropriate tools to tackle dengue. And you can look at them as, in urban settings, you have dengue. In rural settings, you have malaria. And like you've said, if we can bring sort of the collective effort to tackling both diseases. However, dengue control is substantially underfunded, just like malaria.
Right, underfunding that comes perhaps from the fact that, right, the disease is especially prevalent in Africa and Asia. Thank you so much for joining us on France 24 and answering our questions on World Malaria Day.
Thank you very much, Shona.